broader clinical evidence and meta-analyses. Hello everyone, and welcome back. In our last lecture, we looked at key clinical trials of hypnotherapy, studies that compared hypnosis to CBT, sleep medication, and combinations with trauma therapies. We saw that hypnosis often acts as an enhancer, making existing therapies more effective and addressing stubborn symptoms like insomnia. Today, we're going to take a step back and look at the bigger picture. What happens when researchers pool dozens of studies together in meta-analyses? Meta-analyses are powerful because they combine results across trials, giving us a clearer sense of whether hypnotherapy is effective across different settings, populations, and conditions. Hypnosis for PTSD. Let's begin with trauma, since that's our focus. A 2016 meta-analysis reviewed randomized controlled trials of hypnosis for post-traumatic stress disorder. The findings were very encouraging. Hypnosis had a large effect size with Cohen's d around 1.17. That means the average participant receiving hypnotherapy improved more than about 85% of participants in control conditions. Benefits were not just immediate, they were stable over time, lasting up to 12 months in follow-up studies. For a field where dropout rates and treatment resistance are common, these results are especially promising. Hypnosis for anxiety. Now, what about anxiety disorders? A 2019 meta-analysis looked at 15 clinical trials of hypnotherapy for different types of anxiety. The short-term effect size was 0.79, which is a strong result. Even more interesting, the long-term effect size was even higher, around 0.99. This suggests that hypnosis not only reduces anxiety in the short term, but that the benefits may actually grow stronger over time as post-hypnotic suggestions and skills continue to influence daily life. And once again, outcomes were best when hypnosis was combined with other therapies rather than used alone. Hypnosis for depression. Another 2019 meta-analysis focused on depression. Here, 10 studies were analyzed. The short-term effect size was 0.71, a medium to large effect. At long-term follow-up, the effect size dropped somewhat to 0.52, but still showed significant benefits. This tells us that hypnotherapy can meaningfully reduce depressive symptoms, though ongoing reinforcement may be important for maintaining gains. Hypnosis for pain management. One of the most well-documented areas of hypnosis research is pain management. A 2021 meta-analysis of 45 trials found medium effect sizes of 0.60, 0.61 for pain reduction. Effects were stronger in studies with higher methodological quality. This makes sense because pain is both a physical and a psychological experience. By altering attention, expectation, and perception, hypnosis can change how pain is processed in the brain. Hypnosis for psychosomatic disorders. Finally, a 2007 meta-analysis looked at 21 studies on psychosomatic conditions, things like irritable bowel syndrome, skin disorders, and functional syndromes that straddle the mind-body boundary. The effect size here was 0.61, again in the moderate to large range. Importantly, the researchers noted that modern hypnosis techniques were more effective than older, classic approaches or mixed methods. This reflects the evolution of the field, with more personalized, flexible methods producing stronger results than rigid, one-size-fits-all scripts, pulling it all together. So, across PTSD, anxiety, depression, pain, and psychosomatic conditions, the evidence is consistent. Hypnosis has moderate to large effects. It often works best as an adjunctive therapy, not as a replacement. Benefits tend to be stable over time, and in some cases even grow stronger. Modern, flexible approaches to hypnosis are more effective than traditional, rigid ones. The overall message from these meta-analyses is clear. Hypnotherapy is not fringe science. It is a well-supported, evidence-based intervention with broad applications in both mental and physical health. Key takeaways. To summarize today's lecture: PTSD, large effects D1.17, stable up to 12 months. Anxiety, strong effects short-term, 0.79, even stronger long-term, 0.99. Depression, medium to large effects short-term, 0.71, still significant long-term, 0.52. Pain, moderate effects, 0.60, 0.61, especially in high-quality studies. Psychosomatic disorders, moderate to large effects, 0.61, strongest with modern hypnosis. In our next lecture, we'll wrap up this chapter by looking at comparative efficacy, how hypnotherapy stacks up against other psychological and pharmacological treatments, and the unique advantages it offers in psychotherapy.